Reporter Linda Mnisi, who is currently at the SAHRC Field Hospital in Johannesburg. A very good afternoon to you, Linda. For most part of today, you have been at the SAHRC Centre at the Field Hospital with the SA Human Rights Council. But breaking news that they too are going to be probing the investigations into the irregular procurement regarding PPE.
Indeed, Tammy, as the leadership of the Gauteng Department of Health in the province is in limbo and has met another hurdle, the South African Human Rights Commission is the latest to join that alleged PPE tender corruption probe. They say they too will be probing the matter, as it speaks to a lot of issues around the integrity of the department, as well as, placing the lives of the people of Gauteng at risk. But to further elaborate on this, I've got with me Buang Jones, who'll give us a sense then of what these investigations will entail. Buang, you're saying that you are joining the SIU and other bodies that are investigating this matter. What exactly will your probe entail?
We are conducting our own independent investigation into alleged tender irregularities in the procurement of COVID-19 goods and services. And the focus of our investigation is on the Department of Health, because we want to look at the impact of alleged irregularities in public procurement on the right to health.
Already there are allegations, that include the MEC as well as the President's spokesperson and her husband. The ANC today taking a decision that they'll put the MEC on leave. Do you welcome that step, seeing that you are quite concerned about the alleged corruption that's going on in this department?
Well, we welcome the decision that has been taken to allow the investigations to proceed without any hindrance. And our investigations will also continue without any undue interference, because we believe that there is a link between corruption and our socioeconomic challenges in Gauteng. And there are so many other systemic failures that have been reported over the years, from governance to administration, from the optimal management of financial resources in the Gauteng government. And our focus will be looking at the resources or financial resources that have been allocated to respond to COVID-19 and how government has used these resources to realize human rights. We will also be looking at this entire saga surrounding the Department of Health through the human rights lens. And we are hopeful that through our own intervention, we'll be able to unearth some of the information which may then assist law enforcement agencies to apprehend suspects and to secure convictions should our investigation prove that there is credence to allegations of maladministration, corruption, and improper conduct.
We heard that Royal Batra had indeed, done the work but had not received payment, which they say they don't see any irregularity in that particular sense. But you're here at SAHRC assessing, their state of readiness. You've had an opportunity to also look at those PPEs. Now, how would the lives of the people of Gauteng be placed at risk by such corruption?
Corruption, firstly, has impacts on the bidders who were bidding for some of the tenders. But it also impacts on the hospital users, because over the years we've lamented about the state of the healthcare system in Gauteng. Even the Premier, in his State of the Province address in 2019, acknowledged that the health system in this province suffers from what he called believability. And there have been concerns about critical shortage of human resources, medical equipment, the dire state of the physical infrastructure. And we thought the Department of Health would use COVID-19 as an opportunity to address some of these challenges, systemic challenges that have been plaguing the department over the years. And our investigation will also see to it that all the relevant documents are subpoenaed. The contracts, the names of the suppliers, those who were involved, the directors, how the procurement was done, was it in line with Section 217 of the Constitution? Was it competitive? Was it fair? Was it just and equitable? Was it cost effective? We will be looking at all those issues through the human rights lens. And